What is an education, health and social care plan, and who is it for? In 2014, the Children and Families Act became law and introduced a new system of support which is relevant to parents and carers of children and young people aged 0 to 25 who have special educational needs or disabilities. This means that there is a requirement to produce education, health and care plans, or EHCPs, using person-centred approaches. EHCPs replace statements of special educational needs and what were called learning difficulty assessments. Two of the key messages featuring in the Children and Families Act are that preparation for adulthood starts in early years, just as it does for all other children, and all education providers are required to establish and maintain a culture of high expectations so all children and young people can achieve well. This means that goals set should be challenging not just for the children and young people, but for the education service providers too. This requires plans to have a much wider scope than a statement, which generally only address the needs of an educational nature. The plan should, wherever possible, stretch across 4 themes: learning and future employment, home and independence, friends, relationships and community, and health and well-being. Local authorities must issue a plan for a child or young person whose needs cannot be met from the expected budget in mainstream schools or settings, and for those who attend special schools or specialist colleges. An EHCP has 17 sections labelled A to K. Each section has a different purpose, and it is a legally binding document, meaning that certain things in it must happen. The contents of the EHCP are intended to be creative and a shared challenge for all those involved in order to achieve the best possible results and outcomes for the child or young person. In developing a plan, local authorities have a duty to take into account Section 19 principles and must have regard to the views, wishes and feelings of the child, young person or parent, the importance of their full participation in decisions, the importance of their being provided with the necessary information and support to participate, and the need to support the child or young person to achieve the best possible educational and other outcomes, preparing them effectively for adulthood. How can you find out more or access local services and support? You can find out more about the SEND reforms and the education, health and care planning process by visiting the local offer page on your local authority website. Here, you'll be able to find impartial information, advice and support, and learn about all the services that are available to you. Parents who require additional support are referred to their local information, advice and support service. Further information, including a useful resource on writing good quality EHC plans, can be found at councilfordisabledchildren.org.uk.